There's a really interesting complicating factor with premature ejaculation. Honestly, I don't know if it is a corollary issue or a causative issue, and I think it's probably both. Anxiety and premature ejaculation seem to go hand in hand. Now, it really gets messy because premature ejaculation can cause anxiety, and anxiety can cause premature ejaculation. So let's sort it out just a little bit. First, we have to understand what an ejaculation is, right? An ejaculation is different from an orgasm, and it's different from an erection, and you can ejaculate without an erection, and you can ejaculate without an orgasm, and they can happen all at the same time or sometime around each other, whatever. It doesn't matter. An ejaculation is a very specific lower spinal cord reflex. Okay, just like when you're at the doctor's and they bang your knee to check your reflex, your ejaculation is the very same thing. So you ejaculate after you essentially hit the right triggers, just like your doctor triggers your knee to bounce. If you do penile stimulation, if you do arousal, if you do enough tight muscles in your body, you tense up the right things, you're going to ejaculate. Ejaculation is controlled by a lower spinal cord nodule. Now it's really interesting. Below your rib cage, this is a little interesting anatomy, your spinal cord turns into a whole bunch of little strings of nerves. It almost looks like a horse's tail. Up in your rib cage to your head, it's a solid cord of nerve. Below that, there are all these little strings of nerves. Along these strings of nerves are little nodules. These little nodules are in effect miniature brains. So there's one at the base of your sacrum, and there's one at the base of your lumbar, and those two control your ejaculation. It's really interesting. If you want to get into it in detail, you can Google it, but it's really important to realize that an ejaculation is when your nervous system is stimulated enough to send orders to your penis to contract the muscles to ejaculate the semen. Okay? It's as simple as that. What we have to do if you're trying to ejaculate later is learn how to turn off specific triggers for an ejaculation. That may sound a little complicated, but here's what I'm talking about. The triggers that cause an ejaculation are primarily stimulation, right? So mostly stimulation of your penis. So the first thing we do is slow that down. A lot of guys, when they penetrate, they're just thrusting and thrusting like they see in porn, just like pound and pound away. Listen, don't do it. It's going to cause you to ejaculate. Slow way down. Ease up on the stimulation and breathe. Most guys don't realize they hardly ever breathe when they're having sex. I tell guys one of the great exercises for premature ejaculation is approach masturbation and sex as if you were doing yoga. Yoga is all about breathing in, breathing out. If you start slowing down all your stimulation and connecting it to breath, you'll discover you can last a lot longer. So slow down stimulation, that's the number one trigger. Number two, connect it to your breath. Connect everything to your breath. Every move, everything. Start doing sex like yoga. Keep relaxed. Remember, we want to do the opposite of tickling or triggering or startling or jumping. We want you to be super mellow. I used this once with one guy and he thought it was kind of funny. I want you to have sex like James Bond. I'm sure James Bond did not have premature ejaculation because everything he did was so cool and loose and laid back, right? I need you to have sex like that. Do not have sex like the Energizer Bunny. You will ejaculate way faster than you want.